Lovely people, welcome back to my channel. My name is Abdul Malik. You can call me Experience One. Today we are going to look at breast self-examination, how to examine your breast. And then one thing you should note is that this particular procedure is done once every month from the onset of your menstruation, and then a week later. So meaning when the day that you start your menstruation, you count 7 days, or a week later after during a week later of your menstruation. That is when you do this breast self-examination. So some will say that from the a week of the menstruation, that is when you do this particular one. Please, if you have not yet subscribed, kindly subscribe, and then you like it and you share. This is very important to help us grow our channel. Today, let's look at breast self-examination. Breast self-examination should be conducted once every month by all women starting from age 20. This is very important. And then it's not only age 20 to 20 years, but people from 20 to 40 years. And a woman age 40 on and over, okay, we should do continuous breast examination annually, meaning every year they should go in for a regular checkup because of the incident of breast cancer. Now, breast self-examination is the inspection and palpation of the breast by the woman herself. Take note of that. By the woman herself. The role of the primary healthcare physical or staff is to provide necessary information to women and to make them competent in breast examination. This is very important. Okay, so you know, when it comes to the component of breast examination, we have two types. We have the inspection, and then we have the palpation, because you need to stand in front of a mirror to inspect the breast, to know the location, the symmetry, and even if there might be some possible discharges and peeling off, you'll be able to know all these things through inspection. This is very, very important. Now, another thing that we have to look at is that, you see, it is better to conduct breast examination 1 week after the beginning of the menstruation. 1 week after the beginning of the menstruation, and that is exactly what we said. Okay, and then it's supposed to be on monthly basis. Every month you are supposed to do this particular procedure. And then the component, we have the two components, when it comes to breast examination. The first one has to do with inspection, and then the next one, which is the second one, has to do with palpation. Now let us see something here. Inspection. During the inspection, you have about 3 positions to stand. And the first one is to to stand in front of a mirror whilst your arms are hanging by the side. This is very important. You stand in front of a mirror, and then your hands should be by your side, hanging by your side. And the second one is that you put your hand on your waist, or hands pressed on the on the waist, in order to know the symmetry of the breast. This is also very important. And the other one, or other position during inspection, is to raise your arms over the head in order to also examine or inspect the breast. This is how we inspect. Now, during these positions, what are you going to see and what are you going to inspect? That is very important, because we have to assume these positions in order to inspect certain things that is required. When you see, then you know that there might be a problem. Maybe there is a possible breast cancer. Now, the first one is that, let's look at the position of breast inspection. Now, what are you going to note? Note the changes mentioned below. And what are they? One is skin changes of the breast. This is very important. The skin changes of the breast. And the second one has to do with the color changes of the breast. The color change of the breast. Meaning the breast is going to change color. And the other one has to do with change in shape of the breast. When the shape of the breast changes, it's also one of the things that should tell you that there might be a problem. Possibly there is going to be a breast cancer. And then we have orange peel, or peel the orange appearance of the breast, as we mentioned in during the part 1 of the breast cancer. We mentioned that. And then we're also going to inspect for ulceration of the breast. Whenever the breast starts peeling off, there might be a possible wound. And then also we have to look at the symmetry. Symmetry, meaning the breast is supposed to be in line. whenever there's asymmetry, meaning there is a problem with the breast. And then you have to look at the nipple changes, and then the lumps are also very important. This is how the inspection looks like, okay, during these 3 positions. This is very, very important. Now that we have finished inspection, what are we going to do next? The next thing is to what? Is to palpate the breast, to look at any possible lumps, so that we'll be able to what? To see if there might be a possible surgery or something that needs to be done urgently. This is very, very. All right. So now let's look at how do I do a self breast examination, and that is very important. Okay, how do you do a self breast examination? First of all, this is also one of the things that we have to look at: manual breast self examination while standing. In fact, today we are going to talk about breast examination whilst you are standing, and this is what mostly people do, especially when it comes to the time that you are going to shower. And take note, during this examination, the skin is supposed to be slippery in order to feel, okay, the movement of the lumps and then your skin, so much that you can be able to detect any possible problem. Okay, meaning your skin is supposed to be slippery. This is very important. Now use your right hand to examine your left breast, and then it means that you are also going to use your left hand to examine your right breast. So this is a vice versa. Okay, take note of that. Now after you do this thing, now the next thing is that with the pass of your 3 middle fingers, okay, the part of your 3 middle fingers, this is what you are going to do. Press on every part of the breast with the part of the 3 middle fingers. Okay, press on every part of the breast. This is very, very important. Now use light pressure. That is whenever you are pressing, okay, you should press lightly. Then you progress, or you proceed with the medium pressing, okay, pressing of the tissue. Then okay, and then also you press the tissue nearest the armpit, okay, whilst you move. This is very, very important. So let's take important notice to that. Now one thing about it is that during palpation, okay, a circle pattern may help you make sure you hit what? The part. That is when you are palpating. Okay, you're supposed to move what? In a circular motion in order to help you, okay, so that if there's any possible lump, okay, you'll be able to look at them well, and then you look at the possible movement of this lump. When you are done with all this thing, what the next thing is that you need to be sure to check under your areola, the area around your nipple, and then squeeze your nipple to check for any possible discharges. Repeat the steps on the other side. Okay, repeat the steps on the other side. This is very important. So first of all, we are saying that we need to use, you said that the first of all we said use your right hand to examine your left, meaning you are using your right hand, okay, and then feel for any possible lumps, thick spots or other changes. And then a circular pattern may help you make sure you hit every spot. This is very important. And the next thing is to use what? The middle 3 fingers here. And then what do? You start use a light pressure, then medium, then firm, then press the tissue nearest your armpit. This is very important. Okay, the next thing is to what? Is to be sure to check under your areola and then also the possible discharge, okay, on the breast. You have to look at all that to be able to help you out. So this comes to the end of the breast self-examination, okay, while standing. And then make sure you stand in front of a mirror whilst your body is slippery. You'll be able to do all these things. This comes to the end of the class. Please, if you need or anything about NCLEX, can you contact us, okay, so that we can, anything that is needed with regards to NCLEX, we are here to help you out. Thank you once again. Please kindly subscribe and then like our videos and share it for people to get access to them. Have a nice day. Bye-bye.